Wisconsin's second documented case of monkeypox is in Milwaukee. Nearly 900 cases reported across the country, more than 9,000 reported worldwide. Mary Jo Ola talked with a doctor about what this disease is and what we need to know about it. She joins us in studio right now with more on that. Mary Jo.
Steve, today a spokesperson for Milwaukee's health department says the infected person is doing well and isolating at home. Local health leaders do expect to see more cases. They also stress that the risk to the general public remains low, and right now education is important.
An outbreak of a rare disease called monkeypox has made its way to Milwaukee. The city's health department says that person is isolating and notified close contacts.
How concerned should people be about contracting monkeypox? How dangerous or contagious is it?
Well, it's important to know that this isn't COVID. It's not nearly as transmissible as COVID.
Dr. Ben Weston is an emergency physician at Frederick Hospital.
There is some droplet respiratory spread of monkeypox that's possible, but we're really talking hours of interaction time as opposed to just a few seconds or minutes like COVID. The more typical transmission is skin-to-skin contact, prolonged skin-to-skin contact.
Touching objects and surfaces that have been used by an infected person can also transmit the disease. Dr. Weston says monkeypox has an incubation period from when you're exposed to when symptoms start. That's between 5 days to 2 weeks. Symptoms include fever, chills, and body aches, but the rashes and skin lesions that develop set this disease apart. They can look like pimples or blisters. Recovery may take 2 to 4 weeks.
For most people, it's a self-limited illness. Most people don't require, intensive medical treatment or hospitalization or anything like that. But what is important is to prevent that spread to others. And that's where the vaccine comes into play.
With monkeypox, healthcare providers want to vaccinate the person who is infected and the people around them to prevent spread. Dr. Weston says right now a lot of educational efforts are underway in the medical community.
Monkeypox is just not something that the vast majority of us have ever seen in our careers. We see pictures of it, we can read about it, but we haven't actually seen it in patients. And so understanding what precautions do you take.
Now, local and national health agencies are sorting out the logistics on how to prevent spread as much as possible. But if you were exposed to monkeypox or concerned you might have it, you should isolate and contact your healthcare provider or local health department to get tested.
Mary Jo, who is coming down with monkeypox? Do they have anything in common?
So right now, the reports are that the recorded cases are largely among men who have sex with men who have multiple partners, but it's important to note that anyone can develop an infection.
All right, Mary Jo, thank you.